I'm Nyanzi Fredrick, the project manager of the Aged Family Uganda and the founder. I'm talking about common problems of older persons, and I will concentrate much on Alzheimer dementia. Older persons suffer from a number of problems, but among the problems, one of them is the most problem in Uganda are falls, but it is more particular in the rural areas than the urban areas. However, they have another problem of isolation, depression, stress, polypharmacy, incontinence, elder abuse, and there is so much ageism in Uganda. We can look at the common diseases. They suffer from hypertension, arthritis, diabetes, renal failure, cancer, Parkinson, and more so Alzheimer dementia. I have to tell you that the percentage of Alzheimer dementia in Uganda is only slightly 15% for all the older persons. I'm saying Alzheimer dementia is a chronic progressive neurodegenerative disorder characterized by global non-reversible impairment in cerebral functioning, characterized by memory loss, loss of social occupational functioning, diminished emotion, speech and motor deficiency, plus behavior and psychological disturbances. We have the mild stage, middle stage, and severe. I would tell you that it is very difficult to care for somebody suffering from Alzheimer dementia in the early stage, rather than in the severe stage. We are saying Alzheimer dementia, it is non-reversible, it is progressive. I want to look at the signs of Alzheimer dementia. The most important sign is memory loss, which leads to forgetting. For example, somebody can call you a name when you're afraid, he calls you John. How are you, John? It moves, it keeps the glasses on the head and is looking for the glasses. He moves with the knife going to the banana plantation to get banana leaves, and he asks, where is my knife? Wondering and being restless. What I always tell my caregiver, be patient. How do you intervene according to the signs we have seen? A multiple approach after detective work based on behavior and the psychological approach is needed. But more so, I am telling them, don't contradict. Don't contradict. If he calls you, John, how are you, John? You say, yes, I'm fine. Don't contradict. Keep very few items in the room so that that person may fail to get where he can keep the objects. More so, Alzheimer patients, they get money, you give out money, he gets the money, keeps it somewhere, and after a few moments, he will ask, where is my money? Always provide identification to the client so that in case he gets lost, he may be able to be identified. Maintain a routine practice. What you have done today should be what you do tomorrow and the other day. How you maintain the house, the order of the house should be on a routine practice. You can care for an Alzheimer patient very well, but be patient and have empathy. I think that is how you can intervene when you are caring for a patient suffering from Alzheimer dementia. Sometimes they wake up, he can recall what he used to do long time ago. wakes up in the morning, puts on the necktie, gets the briefcase, goes to wait for a bus. Please don't contradict, however, redirect. In Uganda, we advocate for the family. Most of the older persons having Alzheimer's dementia should be kept within their families. Rather than taking them to the senior citizens' home, it is better they are handled in the family. But as the Aged Family Uganda and the other organizations, other care organizations, we are sensitizing the family members to know the cause of Alzheimer's dementia and how you can treat a person suffering from Alzheimer's dementia. And more so, we tell them that even me and you can get Alzheimer's dementia. People do not want to get Alzheimer's dementia, but you find yourself getting Alzheimer's dementia and you can't prevent it. It just comes. It's not inherited. There are no basic ways you can prevent yourself from getting Alzheimer's dementia. Therefore, sensitizing the family is more important so that the people can know that this person has got Alzheimer's dementia and the person is not psychiatric. The person is not mad. And it is not easy to train that person rather than only using a routine practice and keeping the members in their family. Very few people have the knowledge about Alzheimer's dementia. We have a psychiatric unit in Uganda called Butabika. When somebody has got Alzheimer's dementia, they think is psychiatric and is being taken to the psychiatric unit. Therefore, our challenge is from the family members to carry out their duties of caring for the people suffering from Alzheimer's dementia. Another challenge is more so lack of information and the knowledge about the disease. More especially in Uganda, Africa, I want the members to understand that Alzheimer's dementia is not psychiatric. Alzheimer's dementia is not witch. It's not as a result of witchcraft. Alzheimer's dementia is non-reversible. Alzheimer's dementia is progressive to go through the stages. Therefore, the family members should get the knowledge. It's not out of witch. It's not what some members, you visit a family and they say, in the name of Jesus, in the name of Allah, this person will be okay. I don't think prayers can reverse Alzheimer's dementia. I don't think witchcraft can reverse Alzheimer's dementia. I don't think a lot of medication can reverse Alzheimer's dementia. But the members should know what causes. How do I deal with a person suffering from Alzheimer's dementia? How do I handle? Keeping in mind that you can also get the disease. Lastly, you have to be patient.
Nikikuona roho yangu mimi natulia, nikitembea na wewe nasikia furaha moyoni. Ma chérie, je t'aime mon amour, nalingio na motema nanga nyoso. Chérie, nalingio yudi wanga wa motema.
Unavyonitazama baby, oh. Unavyonipapasa baby, oh. Niambie niongeze baby, niambie niongeze baby, maana your love baby, your love, your love, your love. Sioni mwingine baby, ni wewe tu. Sioni mwingine baby, ni wewe tu. Nashukuru Mola kukupa kukupata baby wangu. Nashukuru Mungu kukupata my love. I will love you, love you, love you. Nikifo tu baby kitatutenga mimi